So, hello everyone, and welcome to our Instagram Live series Beyond Beauty. Tonight's topic is all about PDO threads and their incredible benefits. We have a special guest speaker, Dr. Stevens. As always, will be sharing valuable insights with us. But before we dive in, let's quickly touch on the effect of gravity and aging on skin. As we age, our skin naturally loses elasticity and firmness. This, coupled with our factors like sun exposure, smoking, and lack of proper skincare, can lead to various skin issues such as hyperpigmentation, dryness, and unhealthy looking skin. But fear not, with advancements in technology and medicine, there are non surgical options available to address these concerns. And PDO Threads is one such option that's less invasive, cost effective, and delivers amazing results without the need for surgery. Now, let's introduce our guest speaker once more, Dr. Stevenson, who will enlighten us further on the benefits of PDO Threads and the areas they target.
Hi, welcome and happy Wednesday. I am Dr. Stevenson, and then today our topic is going to be talking about PDO threads. So what PDO threads are, there are sutures that we use to help lift the face. So there are non-surgical threads. These threads have been out in the aesthetic business for hundreds of years. So it's not new, but it's just something now that we're implementing over the past several years into the field of aesthetics. So what PDO threads are is there are threads that are used under the skin to help rejuvenate your skin. They build collagen. You won't see the best results of the PDO threads until a couple of months later. More like around 3 to 6 months, you get the best results.
Mm-hmm.
But when you do a PDO thread, you're going to see the improvement the same day. But like I said, the best results you're going to see within the next 3 to 6 months. These PDO threads stay under the skin for a good 6 to 8 weeks, sometimes a little bit longer. It could be several months before they dissolve on their own. So they just dissolve, turn into sugar, and your body just expels them and just deplete them, and you just it just wastes through your body, and then that's it.
Mm-hmm.
Okay, so your body metabolizes them.
Okay.
So yes. So the great thing about PDO thread is that there's so many different areas of the face that you can lift with PDO threads.
Mm-hmm.
My favorite is to do like we call it a 3-cheek vector lift, which is pulling up the cheekbone and the jawline. So that's my favorite PDO thread. And what it does is it just give you that nice youthful appearance and tighten your skin as it's building up your collagen. So it's stimulating collagen and building your collagen. I also like for you to do also the smooth threads. So there's some people who don't need lifting, but they're having like sagging skin, losing collagen. So that's when I recommend that you use a smooth thread to help stimulate and build collagen. And besides your face, PDO threads can be used any part of the body. It could be your arms, your knees, your thighs, your butt. There's many different areas that you can use these threads on.
Okay. That's actually fascinating and very versatile of PDO threads. Can you tell us a bit though more about the procedure and itself and what clients can expect from it?
So I always recommend anyone who's looking to do PDO thread is that you go to someone who is certified and trained to do these procedures. This is not some place that you just go to anyone and you do. It should be done in a clinical setting by a healthcare professional that are trained in threads. So when I say PDO threads, there's different types of threads. So PDO thread is just one of the threads. So we have PCLs. That does mean they have different meaning to it. And I won't dive into that because the whole concept is just telling you that there are non-surgical procedures that you can use to lift the face, and these are called threads. And I explained to you there's many different types of threads. So when a person comes in to do a thread procedure, I like to get like a good history of them, okay? medical history, any heart disease, any blood thinners that they're taking, aspirins, NSAIDs. All of these things are important because alcohol intake. Because these are a couple of things that can cause you to have complication. And complication means that you can have extensive bleeding, bruising, things that's not pretty, that is going to make your results not very pleasant. So these are important that when you come in, that we have this conversation first. So a good thorough assessment or consultation is important before you do the procedure. If you meet all the criteria for the PDO threads, it can be done on the same day. But if not, then I will tell you to wait and follow the protocol before you do any of these particular procedures. No recent toxins. You just can't come in and have Botox and then now you want to have PDO threads, because I have to give you you get medication to kind of like numb the skin. So you get lidocaine with some sodium bicarbonate, which is medication, and it numbs the skin before we start your procedure. So what happens is I mark your face, I show you, we discuss, this is what I want, this is not what I want. Whatever area you're looking to lift, I will mark it. I'll play with it a little bit, maneuver it around a little bit to see if you're comfortable with that particular results that are body part that you want to treat. After you says yes, you get a very thorough cleansing of the skin with aseptic solution, followed by you get numb. So after you get numb with the PDO thread, then the procedure starts. So depending on what kind of thread you're getting, some you would need a cannula needle to cause an insertion under the skin, so that I can put the PDO thread underneath it to lift the skin. There's some that have like a sharp point, and then you just insert those without even giving you like the extra cannula boring of the skin. But it's very minimum boring of the skin, so I don't want you to think, oh my God, I'm getting bored. So it's not. So it's or having your skin pierced. It's a very microscopic piercing of the skin. It's just to allow the thread to get inserted under the skin, and then we lift the skin.
Okay. I'm guessing a lot of persons would prefer that procedure other than not everyone is comfortable with going under the blade, so that's great. And how long would results show? How long would it take for us to see effect from this procedure?
You're going to see the results right away, but the best results will come several months later, because the thread is going to keep building your collagen and help tighten your skin. So best results, I would say around 3 to 6 months, you're going to see the best results. So like I said, sometimes sooner, but the best results is at your 3 month window period. That's how most patients wait, like 3 to 6 months, and you see the best results. Even I have patients who come to me that have had plastic surgery, because we're always aging. So even if you have plastic surgery, it doesn't guarantee that your skin will never sag or your skin will not be perfect. So I always tell patients that before you go under the knife, you can always try a PDO thread procedure, because it's a non-surgical procedure and it's reversible. So let's say you come in and you don't like it, we can take the threads out.
Nice.
But there's always a particular time frame. I prefer if you come in and you don't like it, within 2 weeks, we can just go back in and we can just pull the threads out. Some threads are a little bit harder to pull out, so I don't want to tell you, oh, every thread is going to come out, but typically the PDO thread is a little bit more easier than the PCL to take out. But if they don't like it, it can be reversed. So nothing is like 100 set and proof that you get it and you can't get it out. So you can't have the thread taken out within 2 weeks.
Okay. That's actually great. That's reassuring to know. And it's also great to hear that clients can see gradual improvement over time. Is there anything else you'd like to share about PDO threads, or any, thoughts for our viewers?
Yeah, so there's a lot of things that happen after PDO threads. You have restrictions. So you're restricted for at least about a week. Of like not exercising, nothing aggressive, cut down the alcohol intake because there's bruising, healing time, no NSAIDs. You may get like a little bit tingling or sharp sensation and occasionally from the threads. That's normal. Over time, it will go away. So there are little bits, like some patients have said that they've had like sensation, like tingling sensation or shocking sensation. Over time, that will go away.
Okay. And I'm guessing that you can't really put a time frame on when persons would see results because everyone's result would be different. Because, you know, for example, if I came in for PDO threads versus someone that's probably much older than I am, I'm guessing we'd have a different time frame where we'd see the results, right?
The results right away. You're gonna see the results the same day that you have the procedure done. But some people may have more bruising and more swelling. So once the swelling go away, you're gonna start to see the results.
Oh.
So let's say someone comes in and they have very fragile skin or they bruise very easily. They're gonna be a little bit more swollen within the next 24, 48 hours. It's gonna start to subside, and then you're gonna see the improvement. Some people may take a little bit longer, but you're gonna see the results the same day.
Okay.
Yes.
You mentioned earlier as well that, you know, it's very important for you to know the client's history before you proceed. What are some procedures that a client could have done prior to and it wouldn't, you know, be an issue? And what are some procedures that they could probably get the same day with a PDO?
I don't really like to do anything on top of PDO threads, only because I'm giving them like injectable and anesthetic. So I don't like to have other procedures done when I'm doing the PDO thread. They can do fillers after the PDO thread, but I really don't like to have certain fillers done before PDO thread, because if you do something like radiase or like a Juvederm, something that's more what is it, like a longer acting filler, I would have problems going under the skin, because those fillers will cause more what is it, we call it calcification or structures that cause me not able to get under the skin.
Okay.
Because they're also biostimulatory process like Sculptra. These medications are very similar to the process of PDO threads. So you're going to do Sculptra and they come from PDO threads. I'm going to have a little bit of a problem getting under the skin. Then if you have nothing under the skin, it's easier.
Okay.
I'm not saying that you can't have these done and have threads, just a little bit more difficult and a little bit more of a tougher process of going under the skin once certain fillers are put under the skin.
Okay. All right. Compared to going under the blade, what are some pros and cons that you could possibly highlight about getting PDO threads instead of the? I know you said it's reversible. That's a plus, because, you know, if I don't like it, I can always come in as soon as possible and have it reversed or do something completely different. What are some of the benefits of considering getting PDO threads instead of the surgery, plastic surgery?
So the only benefit really is it's reversible, and you can kind of get an idea of what your face would look like if you had surgery. So I'm not saying that you should not have surgery. Some people may need to have surgery, but I am not saying that PDO thread replaces surgery. It's more a first step before you go to the extreme. Because some people, they go and they get plastic surgery and they're not happy with the results. So at least with the PDO thread, you can kind of have an idea of what you may look like or what may happen if you have a full facelift or a tummy lift, a tummy tuck, a knee lift. You can kind of see an idea of what it's going to look like before you go ahead under the knife.
That's pretty
so it's not a replacement of surgery, but it's kind of like it's a first step.
Okay.
If you're not ready to spend $10,000, $20,000 to do a facelift, you can start by doing a PDO thread procedure. And then there are some people who are young that they're not trying to get a facelift. They're just trying to do like something a little bit aesthetic.
Yeah.
So PDO thread is good for aesthetics too for young people. If you want to do like an eyebrow lift, you know, that's a PDO thread. If you want to do your eyes where a little bit more slanted, that's a PDO thread. If you want to lift the nose, that's a PDO thread. So there's many things that you can do with PDO threads. If you want to have a stronger lip border, we call it the vermilion border, you can do threads. So there's many things that you can do with threads besides, you know, saying that you're like omitting surgery, but it's aesthetics. So there's many different aspects of threads.
Okay. And how often could I get you know, PDO thread procedure done?
It all depends on the age. So someone who is young, typically the thread should last you a good 2 to 5 years, because I've had it done before and it lasted me like over 5 years. So it all depends on the age and the state of your skin at the time when you do it. If you don't have any collagen loss, it's gonna be there for a while. If you're like older and you're aging, you're losing weight, gaining weight, losing weight, then you may need to do it a little bit more often. I tell most patients who are looking for collagen loss or sagging skin that they do a PDO thread. I would say between 2 to 3 years, they'll do a touch up.
Okay.
Okay. Or they may have to do it again. But it's not something that's going to be forever. It's not lifetime.
Yeah.
So you have to still do touch up from time to time.
All right. And if someone comes in that has different areas, areas that they'd like to address, would you normally do it all together, or or space it out, or how many procedures could the person get in a session?
They can do whatever they want, but for time frame and for pain and comfort, I like to ask them what is bothering them the most first.
Okay.
So if someone comes in and there's nothing wrong with their cheek, I'm not gonna say to them, okay, you need a cheek lift. If they're concerned with their jaws or their neck, then that's what I'll focus on. But there's sometimes too that if I'm doing a procedure, as I explained to you, that I do an assessment. So I'm moving the skin. So they come in and I'm going to do a neck lift, and I see that they need to have a tightening in their cheek. I'm going to mention that.
Right.
So it all depends on the client, what they can afford and what they want to do, and their time frame that they have. So there's many things that goes into play when we're doing PDO threads. So you can do your knees, you can do your body, you can do multiple areas, but for comfort and for medication, because I use lidocaine, I don't want to overdose someone and get them too much lidocaine in one day. So we can do it in step approach. They can come in today and they can do their cheek or their neck. Then a couple of days later they come in and they do their knee, their stomach. So you can mix it up.
Okay. And it's a known fact that BME is all about empowering their clients and stuff. So naturally you would have recommended the best procedure, the best thing that they should do. So for, like you just highlighted, someone could come in and think that the neck area is the problematic area, but you see something else based on your expertise. So I actually love that fact. And what about post-care?
So post-care is ice. You have to sleep on your back. And all depends on what kind of procedure you had done. I like to have you a little bit elevated. Okay, so no sleeping on your face, on your back, ice, Arnicare, no NSAIDs, no aspirin, no Motrin, no alcohol, and no exercising for these 5 to 10 days.
Okay.
And that's pretty much all the post-care. And if they have pain, they can take Tylenol. Some people, they may feel a little bit, everybody has different pain levels. So some people may need something to comfort them. So if they want to take Tylenol, then I recommend taking Tylenol.
Okay, and what about the topical products? Like, what if the person has a skincare regimen? Should they avoid doing that during the recovery period?
No, you continue skin regimen. Only thing that I recommend is that they make sure that they're using aseptic technique. Okay, so they're gonna wash their face. They're gonna wash it right. They're gonna wash it very clean. They're gonna not use a towel or a washcloth that they had before they had the procedure done. Fresh washcloth, because we're trying to prevent any infection. Remember, the skin is bored, so anytime your skin is cut, there's high risk for infection.
Right.
But the skin has to be clean.
Okay.
But you don't stop your skin routine. You continue your skin routine. The only thing that I recommend if you're doing your face, that you don't put any like retinoid cream, anything that's going to cause your skin to burn or tingle until at least 5 days after.
Okay. All right. Sounds doable. To our viewers, does anyone have any questions? Anything piqued your interest? I know my interest is piqued for reasons I will not.
And PDO thread is like one of my favorite procedures. I love doing, besides from doing like lips, is like my favorite. But when it comes after fillers and lips, then my favorite is PDO thread, because it's such artistry. It's like amazing what you can do to someone's face just by just using thread lifts.
Yeah, I actually consider your line of duty as an art, of the body. You have to pay attention to our contours and stuff like that, beautifying, empowering from the inside out. So you're right, it is art, actually. Any questions? questions, anyone? No. Okay. I mean, if that's all, is there anything else you'd like to add? Any tips?
As I mentioned early on, it's important that when you're doing aesthetic procedure, especially when it comes to infection protocol, that you go to someone who is trained and well versed in the procedures that is being offered. Your life is important, your safety is important, and the risk of infection lessen when you have someone who's trained and know what they're doing. So I recommend that you go to a medical provider that is trained in the procedure that you choose to what is it you choose to do, or you want to engage them.
Mm-hmm.
That you pick one that's trained in that particular area.
Right.
So that's what I want to hear. So like a medical provider who's trained in the area that you're choosing to pick for your procedure.
Right, because you are important, guys. Your health is important. Put your life, because when you're doing these procedures, I believe that you're actually putting your life in these person's hands. So why not do it with someone that is professionally certified to have this done, to avoid hiccups and stuff like that. Because remember, our last Beyond Beauty session was about procedures and protocols, safety protocols that are put in place to make sure that you guys are okay, and to minimize or diminish rather the amount of fatalities that are happening in these areas. So we advise strongly on seeking professionals, and BMA staff includes nothing or anyone that is not professionally trained to do the procedures.
Yeah, I wanted to show before we go what a thread looks like. I'm not going to open up all the packages because I like everything to be sterile. There's different types of PDO threads. So this is pretty much what it looks like. So these threads will need to be, you will need to have the candle needle in place. So this is what PDO threads look like. Okay.
What is that in your hand?
These are PDO threads. So the different lengths of different types. So your procedure is based on what you want to do, what you're trying to accomplish, and the length of your face. So everyone doesn't need a 20 gauge or 20 millimeter thread, because people just need like a small lift. So all depends on it. Like me, I can get away with this. Some people, they can't. They need a little bit more lifting. So it all depends on what they're trying to accomplish. Okay.
And does it require different threads for different areas, or no?
Sorry, I didn't catch that.
Does it require different threads for?
Yes. Yes. So that one that I just showed you, these are barbs. So the small one is 6 centimeters, and then the other one is 15 centimeters. So it all depends on what you want. There's bigger sizes or longer lengths depending on what you're trying to accomplish.
Okay. Do you have the micro needle that you said that you'd use?
Oh, the candle needle. So it's just a so there's many ones. So you can do it many ways. I don't want to scare people by showing them the different. So I use this device. So this device is just to help for the skin. Okay, so it's like, you see that it's like a tip needle, if you can see at the tip of the needle.
We're not really, we're seeing it now.
Yeah, can you see it? So this tip here is what pierces this tip here is what pierces the skin. Or another way, I just grab a 18 gauge needle. Or a 20 gauge needle, and I just use that to pierce the skin. So remember, this is only normally I have gloves on. I don't do anything that's gonna cause infection. So this can go garbage when I'm done. So this is, if you can see the needle. Okay. So it's the tip of the needle. Just use the tip of the needle. If you can see me.
Yes, we can.
Yes. So all you do is, I'm not gonna prick myself. You just wherever you're gonna I mark the face. So let's say someone is coming in, and I'm gonna be doing a PDO thread, and let's say they want a cheek lift. So let's say they want a cheek lift. I always play with the face to see where I am going to lift. Then I take the PDO thread, and then I will align to see where it ends to determine which size I'm going to use. And then I will just do the markings. So I'll mark the face. Then they'll get numb here, and then they get numb here.
Right.
It all depends. Some people only need numbing in one spot because you really don't really feel except for pressure when you go under the skin, so it's not really pain. But if someone said that they're having pain, I will numb them along the entire length of the thread.
So you won't feel the needle prick, guys.
No, yeah. So the needle here at this point, what I do is you get your lidocaine and sodium bicarb. The sodium bicarb is going to decrease bleeding, and the lidocaine is for pain. So once I numb this area, then I will take the needle, and then the needle will go and just a tip of the skin, just that much. And that's it. And then that will allow the candle needle, because it's not sharp, it's blunted, to go in under the skin.
Oh, okay.
So that's pretty much the procedure.
And how long does this procedure typically last, or it depends on the amount of work that's being done?
It depends on the patient's tolerance.
Oh.
Typically, it's about 30 minutes. Excuse me. It's about 30 minutes, depending on what I'm doing.
Yeah.
It could be a little bit longer. It could be an hour. Because some patients, I will numb them, and then they go, I'm not ready. So I book my appointments for about an hour when I start doing threads, just to give the patients time to get comfortable.
Okay. Oh, that's very thoughtful.
Yeah.
Okay. So I hope you viewers are watching this, and you're getting a bit more comfortable now that you have more knowledge on the procedure, that you can actually do, get whatever you want to get done without having to go under the knife. So we gotta choose our battles, guys. It's either the knife or PDO threads. I'm personally considering PDO threads.
Yes.
Sounds more doable for me.
Right. So I do have some threads scheduled for this weekend. So if anybody online is interested in PDO threads, or want to come to make an appointment, I do have some spaces left for Saturday. But Saturday is my PDO thread day, and I have several clients already booked for threads.
Okay, you've heard it here, guys.
Which is my second love, as I said. Lips, and then threads.
I'm wondering. I'm genuinely wondering if I'm gonna fall in love with it too. But we'll talk about that. If there's anything else that you'd like to add, or any questions, guys that are watching, you can always reach out to us in our DMs or via our email at info@bluemirageaesthetics.com. You can always visit our website, www.bluemirageaesthetics.com. If you don't feel comfortable, reaching out to us here on live, it's fine. You can give us a call. Could you share the phone number with them, please?
It's 862-223-8449.
Okay. Alrighty. And remember, if you have anyone that might be interested in our lives, you can always share the live, because it's going to be saved on our page here on Instagram, and we'll also upload and we'll be sharing our YouTube page with you guys, so you can get the content there as well. And thank you so much, Dr. Stevenson, for sharing your expertise once more, and thank you to all our viewers for being here, for making the time to be here with us on every Wednesday if you're here. And remember, if you have any further questions, like I said, feel free to reach out, and or have a wonderful evening, and just be beautiful inside out. Remember, beauty comes from within, and we enjoy empowering you. Thanks for watching, and see you guys next week.
Okay, and before everybody go, happy Easter, and have a good Friday.
Yes, happy Easter when it comes, guys.
Thank you.
Bye.
Bye-bye.